Welcome to Quick MCAT Lessons, where I try to explain MCAT topics in 10 minutes or less. Today, we're going to be going over some practice questions regarding the renal system, the excretory system, and some questions on the skin. With that, let's get started. Question 1. The structure and functional unit of the urinary system that plays a primary role in the formation of urine is the answer here is the nephron. Number 2. Which characteristic feature of the descending limb of the loop of Henle allows the movement of water? A. Aquaporins, B. Juxtaglomerular cells, C. Sodium, potassium, and 2-chloride channels, so NKCCs, or D. Glomerulus. The answer here is A. Aquaporins. These are the membrane water channels that allow the movement of water. Number 3. What are the specialized hormone-secreting cells in the kidney called? A. Juxtaglomerular cells, B. Beta islet cells, C. Epithelial cells, or D. Mesangial cells. The answer here is A. Juxtaglomerular cells. These are present near the glomerulus and can detect a reduction of blood pressure, which leads to the secretion of renin. Number 4. Which of the following regions of the kidney is likely to be the most metabolically active? A. The glomerulus, B. The descending limb of the loop of Henle, C. The proximal convoluted tubule, or D. The collecting duct. And the answer here is C. The proximal convoluted tubule, as it's responsible for pumping many different solutes against their concentration gradient. The active transport will require quite a bit of ATP to pump the solutes. The other 3 answer choices use predominantly passive transport. Number 5. The detection of blood cells in a urine sample suggests a problem in which part of the nephron? And the answer here is the glomerulus. Recall that filtration happens in glomerulus, and so if you have large blood cells in the urine, that means the glomerulus filtration has a problem. Number 6. A patient with hypothalamic lesion experiences frequent thirst and urination due to deficiency of which hormone? Aldosterone, antidiuretic hormone, renin, or angiotensin? And the answer here is antidiuretic hormone, because the hypothalamic pituitary lesion could decrease the secretion of posterior pituitary hormones, and antidiuretic hormone deficiency will lead to frequent thirst and frequent urination. Furthermore, antidiuretic hormone is the only hormone of the answers that are released in the posterior pituitary. Aldosterone is released in the adrenal cortex, renin is released in the kidney's juxtaglomerular cells, and angiotensin is made from angiotensinogen in the liver. Number 7. Which of these areas likely has the highest osmolarity? The proximal convoluted tubule, the distal convoluted tubule, the bottom of the loop of Henle, or the collecting duct? And the answer is the bottom of the loop of Henle, because as water travels down the descending limb, water is reabsorbed. This causes the filtrate to become quite concentrated. Number 8. Antidiuretic hormone stimulates the reabsorption of water in which part of the nephron? The ascending limb of loop of Henle, the proximal convoluted tubule, the collecting duct, or peritubular capillaries? The answer is the collecting duct. ADH, or vasopressin, causes water retention in the collecting duct by increasing permeability of the collecting duct to water. Since the collecting duct is deeper into the salty medulla, the water gets reabsorbed. Number 9. Active reabsorption of glucose takes place in which part of the nephron? The loop of Henle, the PCT, the collecting duct, or the DCT? And you should know that the active reabsorption of glucose, amino acids, vitamins, and ions take place in the proximal convoluted tubule of the nephron. Number 10. Which of the following is not an effect of hypoaldosteronism? Increased thirst, frequent urination, increased serum sodium, increased serum potassium? And so, for this question, you should think about what hypoaldosteronism is. And this is essentially a low level of aldosterone, or aldosterone deficiency. And in an aldosterone deficiency, you will reduce the absorption of sodium and water from the distal convoluted tubule, and this would reduce the level of sodium in the blood. and so an increased serum sodium would not be an effect of hypoaldosteronism. So C is the correct answer. Number 11. The inner part of the kidney is referred to as the cortex, glomerulus, medulla, or juxtaglomerular apparatus. This is an easy one. The answer is medulla. Number 12. The loop of Henle uses a counter-current multiplier system to create an area of high ion concentration in the renal medulla. Which of the following statements about the loop of Henle is true? A. The descending limb is permeable to ions and water. B. The descending limb is permeable to water, but not to ions. C. The ascending limb is permeable to ions and water. Or D. The ascending limb is permeable to water, but not to ions. And so for this, you should note that the ascending limb is only permeable to ions, and the descending limb is only permeable to water. And so the only correct answer is B. Number 13. All of the following would increase glomerular filtration rate except A. Constriction of efferent arterioles in the kidney. B. Increased circulatory volume. C. Dilation of afferent arterioles in the kidney. Or D. Increased filtrate osmolarity. And so you should note that increasing glomerular filtration rate would happen if your blood pressure is increased. And so we want to see which of these options increases flow rate to the glomerulus. And so for the first option, constricting efferent arterioles, this would restrict flow out of the glomerulus, as efferent arterioles come after the glomerulus. And so if you constrict these arterioles, then the pressure at the glomerulus would rise and filtration rate would increase. So it's not choice A. If you dilate the afferent arterioles, these are before the glomerulus, and so your flow into the glomerulus would increase. Once again, the pressure at the glomerulus would rise and filtration rate would increase. And finally, increasing circulatory volume would also increase filtration pressure as you just have more volume. And so this leaves choice D. And this makes sense because if the filtrate osmolarity is high, the macula densa won't send signals to stimulate the juxtaglomerular cells, and the GFR will not be increased. Number 14. The kidneys play a role in all of the following processes except erythropoiesis, increased absorption of calcium in the intestine, vasoconstriction, or stimulation of the sympathetic nervous system. And so they play a role in erythropoiesis as they secrete EPO. They play a role in increased absorption of calcium in the intestine due to parathormone. They play a role in vasoconstriction due to angiotensin II, but they don't play a role in stimulation of the sympathetic nervous system. So the answer is D. Number 15. Which of the following statements about angiotensin II is true? Angiotensin II is a vasodilator. Angiotensin II is a substrate for ACE. Or angiotensin II stimulates aldosterone release from the adrenal cortex. And so the answer here is angiotensin II stimulates aldosterone release from the adrenal cortex. Recall that it's not a vasodilator, it's a vasoconstrictor, and it's not a substrate for ACE. Angiotensin I is a substrate for ACE, and that makes angiotensin II. Number 16. Which of the following would most likely be filtered through the glomerulus into Bowman's space? A. Erythrocytes. B. Monosaccharides. C. Platelets. Or D. Proteins. And the answer here is monosaccharides. They are small and frequently absorbed like glucose. Number 17. In which of the following segments of the nephron is sodium not actively transported out of the nephron? The proximal convoluted tubule, the thin portion of the ascending limb of the loop of Henle, the distal convoluted tubule, or the thick portion of the ascending limb of the loop of Henle. And so sodium is actively transported out of the nephron in the proximal and distal convoluted tubules, where the concentration of sodium outside of the nephron is higher than inside. Thus, energy is required to transport the sodium molecules against their concentration gradient. This eliminates choices A and C. In the inner medulla, however, sodium and other ions, such as chloride, diffuse passively down their gradients from the thin ascending limb of the loop of Henle, making choice B the correct answer. The thick ascending limb of the loop of Henle is thick because its cells contain many mitochondria which produce the ATP needed for active transport of sodium and chloride out of the filtrate, eliminating choice D. Number 18. Which region of the kidney has the lowest solute concentration under physiological circumstances? The cortex, the outer medulla, the inner medulla, or the renal pelvis? The region of the kidney that has the lowest solute concentration is the cortex. This is where the proximal convoluted tubule and a part of the distal convoluted tubule are found. The solute concentration increases as one descends into the medulla, and concentrated urine can be found in the renal pelvis. Number 19. Starting at the renal artery and ending at the renal vein, correctly show the passage of blood through the vessels of the kidney. And so for this one, I hope you said renal artery. Then you have your afferent arterioles. Then you get to your glomerulus. After that, you have your efferent arterioles. Then you have your vasa recta. And you have your renal vein after that. Number 20. Which of the following statements is false? A. ADH increases water reabsorption in the kidney. B. Aldosterone indirectly increases water reabsorption in the kidney. C. ADH acts directly on the proximal convoluted tubule. Or D. Aldosterone stimulates reabsorption of sodium from the collecting duct. And so for this one, you should know that antidiuretic hormone acts on the collecting duct, and so it does not act on the proximal convoluted tubule, so option C is incorrect. Number 21. In the nephron, amino acids enter the vasa recta via the process of filtration, secretion, excretion, or reabsorption. And the answer here is reabsorption. So, as you may know, essential substances such as glucose, salts, amino acids, and water are reabsorbed from the filtrate and returned to the blood in the vasa recta. In general, reabsorption refers to the movement of solutes from the filtrate back into the blood. Number 22. Under normal physiological circumstances, the primary function of the nephron is to create urine that is hypertonic to the blood, hypotonic to the blood, isotonic to the filtrate, or hypotonic to the vasa recta. And I hope you said it's hypertonic to the blood, as a lot of water is reabsorbed, and so the urine is quite concentrated, and it is therefore hypertonic to the blood. Number 23. Diabetic nephropathy is commonly detected by finding protein in the urine of a patient. In such disease, where is the likely defect in the nephron? Glomerulus, PCT, loop of Henle, or collecting duct? And so filtration happens in the glomerulus, and so this is where the defect would be. And this is because large proteins should not be able to pass through the filter of the glomerulus in the first place. Number 24. A laceration cuts down into a layer of loose connective tissue in the skin. Which layer of the skin is this? Is it the stratum corneum, stratum lucidum, papillary layer, or reticular layer? And so the layer of the skin that is predominantly loose connective tissue is the papillary layer of the dermis. The stratum corneum and stratum lucidum contain dead keratinocytes, while the reticular layer consists of dense connective tissue. So choice C is correct. Number 25. When the pH of the blood is high, which substance is likely to be excreted in larger quantities in the urine? Urea, ammonia, hydrogen ions, or bicarbonate ions? And the answer here is bicarbonate ions. Recall that this is how the kidney regulates blood pH. It regulates it by secreting or reabsorbing hydrogen and bicarbonate ions. And so if you have too high of a pH, you would decrease bicarbonate ions. Number 26. In which layer of the skin can stem cells of keratinocytes be found? Stratum lucidum, stratum granulosum, stratum basale, or stratum corneum? And the answer here is the stratum basale, which is the lowest layer of the epidermis and connects to the dermis. Number 27. A drug is used to prevent the conversion of angiotensin I to angiotensin II. What is a likely effect of this drug? Is it A, increased sodium reabsorption, B, increased potassium reabsorption, C, increased blood pressure, or D, increased blood pH? And so what you're getting with this drug is you're not getting angiotensin II. Angiotensin II leads to aldosterone. Aldosterone leads to increased sodium reabsorption. And so if you don't have this, it's not A. Aldosterone, by increasing sodium reabsorption, also increases water reabsorption. This causes an increased blood pressure, so it also can't be C. And aldosterone also causes the excretion of potassium. And so if you don't have angiotensin II, you don't have aldosterone, and you will have an increased potassium reabsorption. On to our last question. Sarin is a potent organophosphate that can be used in chemical warfare. As an inhibitor of acetylcholinesterase, sarin causes excessive buildup of acetylcholine in all synapses where it is a neurotransmitter. Which of the following symptoms would most likely be seen in an individual with sarin poisoning? Increased urination and increased sweating, increased urination and decreased sweating, decreased urination and increased sweating, or decreased urination and decreased sweating. And so an increase of acetylcholine or an excess of acetylcholine will lead to activation of all parasympathetic neurons, all post-preganglionic sympathetic neurons, and the postganglionic sympathetic neurons that innervate sweat glands. Because the parasympathetic nervous system causes contractions of the bladder, one would expect increased urination. The increased activation of sweat glands would lead to increased sweating as well. So the answer is increased sweat and increased urination. That's all for this one. Next time we'll talk about the cell cycle.